Now let's talk about symptoms that
Yeah,
people are experiencing. Can you go in a little bit of detail on what the symptoms of COVID-19 are?
yeah, I can. And this is one of those weird viruses where the variety of symptoms has been phenomenal, and the extent of illness is widely variable. So everything from you don't know you have it and you never know you have it. You got the virus in your system, you got infected, your body fought it off, and you didn't even know it. You didn't skip a beat. You didn't develop any symptoms. And frankly, there's a lot of people like that. That's why, really everybody wearing a mask and washing their hands and trying to stay socially distanced is really important. The most common symptoms are typical cold and flu-like symptoms, right? A sore throat, stuffy nose, headache, you feel tired, a cough, all of those things can happen. And so many viruses can do that. It's interesting that the loss of your sense of smell or the loss of your sense of taste seem to be an interesting and unique couple symptoms that seem unique to this virus and almost diagnostic. It's pretty rare that people have those symptoms and don't have COVID. I'm not sure. It's just interesting how specific that is. But not everybody with COVID loses their sense of taste or smell. So you can't just assume that if you have a cold, but you still can taste and smell things, that you don't have COVID, unfortunately. Those are probably the main things, and most people will have those things, feel rotten for a day or two or longer, and get better. There are people that have kind of a prolonged fatigue. I'm hearing that a lot. And certainly the respiratory distress that can develop in a very small number of the people that get it and end up needing oxygen, end up in the hospital. They just get really short of breath. They develop kind of a pneumonia-like illness. And so those are the people that we see in the hospital. And unfortunately, like I said, the extent of the illness is such that it can be absolutely nothing till it can kill you. And it's doing that to a fair number of people. So it's a weird virus in that sense. Again, most people will have a very mild cold-like illness and get over it. So hopefully that helps.
Yeah, it does, and so, what if you're experiencing some of those symptoms, even if it does maybe chalk itself up to allergies or cold or flu, what should you do if you start seeing some of those symptoms?
Yeah, for years now, we've been telling people if you have a mild cold or a mild sinus infection, give it time. It all passes. You don't need to rush in and certainly don't need antibiotics for viral infections and that sort of thing. So we've kind of had this interesting push to, hey, just give it time, let things run their course, take some tea with honey or lemon, do some symptomatic things that make good common sense, stay hydrated, well rested. And all of those things in terms of taking care of yourself are important. But I think in this day and age with so much COVID around, testing is very important. And so we are really trying to ramp up testing, making sure testing is available. You can call our 1-800 number, 1-800-AVERA. They'll direct you how to get tested. More and more this time of year, it's call your primary care provider, wherever that is, and have them direct you, whether they want to see you in person, whether they want to see you virtually, like we're doing again now. We're doing a lot of virtual visits where it's done over the internet using this type of technology, or whether they want to just do things over the phone, and have you go to a testing location and get tested. But yeah, I think in today's world, in this pandemic, if you have symptoms, you probably want to get tested. Now, I've had some people say, well, I work out on the ranch and I'm not around anybody. And so if I get tested, and I'm positive, they're going to tell me to go home and don't be around anybody. And I guess those are those examples where, okay, I'm not going to argue with that. If it's not going to change what you do, maybe you don't need to get tested. But for a lot of people, it does affect, where they go, what they do, and certainly if they're working in a business or a customer service type activity, it can make a big difference. So
Yeah, absolutely. There's some extra prevention and spread that you can have a direct impact over. So